Welcome back to the monthly table talk. And this is our 128th edition. Our title for today is something of a little heavy, but if you have been following our table talks, it's all about started with food pantries, food banks, then training, and then connecting people and organizations with different services in the community so that we don't only provide emergency food assistance, but actually using that as a way for us to, like a gateway to the community so we can connect them, with other social services that's available and benefits as being a resident or citizen of United States. So today the title is, I call it, the most important news about hunger that rarely makes the headline. So again, that's the title, the most important news about hunger that rarely makes the headline. But before we continue on, I would like to start with prayer and then some updates for this coming weeks and months for Faith, Hope, and Love. God, we thank you today. Thank you for this beautiful day, for the opportunity that you have given us to enjoy the benefits of this country. And also, Lord, most especially being your sons and daughters. Thank you for your provision. We know that we cannot make it here in this world and to the next world without you. So, Lord, I ask that you guide this um, segment of Table Talk for your glory. In Jesus' name, amen. All right, so again, the biggest story about hunger may be the one we cannot see. And I did send this. I wrote this press release, and this will be a series of press release that's talking about the things that we are missing. It's not so much about outcome, which is measuring the number of people that we serve, although that's very important. But the output, I mean, and then the outcome is the transformation of people because we got involved or we got somehow got connected with them. So I'm going to just read to you real quick about this press release because I think the things that we know affect us, and the things that we don't know also affect us. What that means is that we need information, but information alone, if it's not complete, then of course it's not telling the entire story. And today I'm going to attempt to paint a picture for you about this story about hunger that maybe we have not seen, or we talk about it but we have not really seen it. So, but yeah, this coming August, we're going to have our seventh annual Golf Classic, and we have how I would say that we have created a grouping now of people who group of people who are looking forward to this annual golf outing. Of course, it's our seventh year, and we do have regular people, regular sponsors. But if you want to know more about that, you can go to our website and also on our Facebook for current things that's happening about the golf outing. If you would like to be a participant, a volunteer, or a sponsor, you can call me or you can email me at merlin@fhlinternational.org, and I will give you more information. But yeah, put it on your calendar, August 14th, which is the seventh annual FHL Charitable Golf Classic. Now, So let's get into this immediately, and I'm just going to read to you. This is the press release, and again, this is the first one of a series of press release that I'll be sending out to the media, so that they can see and learn more what we're trying to accomplish here in the last almost 2 decades. The new approach challenges America to measure outcomes, not just outputs, in the fight against hunger. So, for decades, communities across America have measured success in the fight against hunger by counting pounds of food distributed, meals served, and household reach. So we know that, we become accustomed to this kind of news, which is very important as well. But what if those numbers only tell part of the story? So, there are things that, if you like to read a book, you read the title, then you get the intrigue, and then you read it, and then you start getting interested to it. But all of a sudden, it stopped. You didn't know really. You're reading just the surface of easier to understand on the book, whether it's a short story or maybe an academic book and textbook, and then you are reading, and then over and over, and then all of a sudden it's not telling the entire story. So if you like stories, if you like storytelling, you give them something first that catch their attention, and then go deeper, step by step, page by page. And this is what I'd like to share with you. Not that it's a complete story, but I hope to paint that picture for you about hunger. Because many times when you say hunger, you think about, you know, maybe 20 years ago or 30 years ago, thinking about Africa, South America, Asia, the poor countries, and you can see starving people, skin and bones, and you were, that's what hunger, that's what the media, what we read, paint the story in our mind, and also the pictures that we see. But see, hunger in United States is different because in this country, there are we throw more food than what we give to charitable organizations so that they can give them away to the people who are in need. Now, let me tell you the background from my perspective. I came from, back then it was third world country, the Philippines, and before I came to United States, I was looking forward. And as I came to United States, my mindset was like, no people go hungry in the land of plenty, the land of opportunity, the greatest country in the world. And yet when I came here, you know um, it opened up my mind that there are people, living in the streets, whether they choose it or not. Food pantries, back in mid 80s. There's not as many food pantries back then, but there are food pantries. And I thought, how could that be in the greatest country in the world that people still go hungry? And that's why I just want to paint that picture for you, because it was like new to me, coming to the greatest country in the world and then see that this thing is happening. And I got connected with a church and did, not just charitable, but actually we helped serve people and got connected with, say, food pantries, nursing homes, and, hospital visitations and everything. So it's like peeling, an onion, or maybe turning the page one at a time, and it's starting to make sense for me. And so, um, my pastor back then trusted me that I thought, hey, why don't we deliver food to the people? So we did deliver food. I think we started with just like five household in an apartment complex. We went there, and then me and a couple other volunteers, um, we buy food with our own money and some from the church, and then we deliver food. And then I start sharing, our faith, and not to proselytize, but we let them know, we share food, and the same thing, we share our faith, and also what we do. And I've seen different changes. Then God started Faith, Hope, and Love. We started serving many people, like um, rehab of houses, painting, helping the elderly at their places, visiting nursing homes, visiting hospitals, and it grew to 1,200 volunteers working not just 1 hour a day, but for 7 days, 7 to 8 hours per day. So we call it mission trip in your own backyard. And through that, the evolution happened that, hey, we don't want just to reach out to people once a year, or to do a mission that become an event, which is, yeah, let's do this every year. And in my mindset at that time, I thought, okay, well, the churches go to say mission, and it's July, we go to say Greece, or we go to Africa, or whatever it is. And then it just came to me that, hey, there are needs in our own community. Why not have a mission right here in our own backyard? And we call it mission trip in your own backyard. And we included the food pantry. And then we started giving away food, and start training food pantries. And then as we train them, we share with them that people in this country are more hungry mentally, emotionally, and spiritually than physically. Again, in the land of plenty, where we throw more food than what we give away, I think that's what's happening. I know, and you probably heard it from the news, that there are people who have plenty of food, plenty of money, maybe millionaires, and they have everything that they need, and yet they kill themselves because they are hungry emotionally, spiritually, and mentally. So I'd just like to premise that for you. So again, I'm going to continue this press release that I wrote. So what happens? So what if those numbers only tell part of the story? So again, going back again, that yes, we have all these outputs, right? The measurement, how many pounds, how many people, how long the line, and all of those, which are all important. But what if those numbers only tell part of the story? As food insecurity continues to affect millions of Americans, imagine that millions of Americans are being affected uh, as considered food insecurity. A growing movement of community leaders, healthcare providers, and charitable organizations are asking a new question. So now we're turning the page. What happened after the food is distributed? So that is a big question for us. We give food, and some people may say, well, that's all I do, and that's fine. But that's not telling the entire story as far as the food insecurity, the ecosystem. So there are people, you have a food pantry, you start a food pantry, you gather food, you put it on the shelves, you send flyers to people, you put the banners out there and invite people to come. And then after they invite the people, then they come to your food pantry, you give food, and most of the time that's the end of it, right? But The new question now, with this evolution of food insecurity, question is that what happens after the food is distributed? Now we can discuss this question for many minutes or even the whole hour here, but we're not going to do that because I just want to paint the picture for you. I just want to give you something to think about. And then perhaps if you would like to learn more about the other press release that I'll be sending out, you can contact me, or you can go to our blog, which is merlinfhl.wordpress.com. So now let's tackle this. What happens after the food is distributed? But let's go back again to just before this. According to the U.S. Department of Agriculture, millions of households continue to experience food insecurity each year, despite billions of pounds of food being distributed through charitable and government programs. So don't just think about food pantries, food banks, but also the WIC and government programs, the school um, uh, food that they provide the children at the school. That's part of the government programs. Which again, I don't have the exact number, but food pantries is just a small part of the whole system of providing food to the general public. And again, the biggest ones are the schools. So hunger remains, despite of all the things that's happening, the billions of pounds of food, and then the waste that accumulate. And I tell you what, here's what I found out, that the regular households are the number one who waste the food. Not everyone, but we throw more food, we waste more food than, say, spoilage, food that's getting rotten from the farm, or maybe the things that we throw at the restaurant. And again, you can Google this, you can check it out. But, with people who have plenty of food in the refrigerator, and many of those are being thrown away because they're not being eaten. Um, so, hunger remains one of the nation's most persistent social challenges. Now, we're going to go into a deeper thing here. When we talk about hunger in this country, many times it's just like hungry, not enough food. But now we can take that to the next step, that yes, there are hungry people who may not look hungry. They may have, maybe overweight, but they are hungry nutritionally. And let me tell you a little bit about that. Um, if you don't have enough money, right? Say, for example, let me paint a picture here for you. Say a retired individual living by himself, having social security, and has to buy prescription medicine, right? Because as people grow old, they need medication, supplements, and everything. So now you have to decide, pay the rent, maybe pay the transportation, the utilities, health insurance, and then you open your refrigerator. There's nothing there because, again, you need to um, pay for the necessities, not just the food, but also your prescription. So now you don't have enough money, and then you go to food pantries, and this is what happened. All right. um, Many times, and not all the time, the food that's being distributed to through food pantries are not the best nutritional food. So they may be high in carbohydrates, high in salt, high in sugar, high in fat, and it's canned, so it's more salt. And then from the food bank, and I'm saying that this is not for everyone, but majority of donated food come from manufacturers, right? From distribution places. Some are not moving and about to expire, and then they donate it to food banks. Food banks then, yeah, they buy food also, nutritional food to supplement those. But again, we're talking about the majority of food here. Then they uh, redistribute the food to the food pantries. So you do have the donors, manufacturers, farmers, producers, ranchers, and then they donate food to the food banks, and then food banks donate the food to the food pantries, who are the retailers, and the food pantries are the one who give food that they receive from majority of them from food banks. And that's why during our training, and we have trained over and established or launched 70 food pantries all around the state of Indiana. And that's why we train them not, yes, there are available food, but even food banks, they don't want you to receive food just from them. They want you also to find it your own, maybe purchase it your own, or maybe find it somewhere else. And that's why at the get-go, with our missional food pantry training program, we train them to find food for themselves and not to depend in one organization. Because what if food banks run out of food? What do you do? And you just wait? No, instead of waiting until the food comes to the food bank, then you have this community. You create a missional community that you offer help, and you offer also opportunities to help others. That's the premise of missional food pantry, uh, is to engage and involve the entire community. But that's part of it. When the food is distributed, and that's what we're talking about now. What happens? So they receive food. Some are nutritious, some are not nutritious. And I'm not saying, that this is all fault of the donors or the food banks or the food pantries. I've seen it happen because some people are uneducated in cooking. We've seen it that, one of our food pantries that we train offer fresh chicken, and this mother, who is a teenager, a mother of one crying baby on her left hand, chose microwavable things instead of fresh fruits, vegetables, and also meat. So that's what happened. But it starts with educating, understanding the uh, the understanding the people that you are serving, and that's building relationship. Once you build relationship, then you can have more trust, the two parties, and then you can offer them prayer. We offer prayer the same way as we offer food and other resources, and then we send them to some potential service organizations that can help them. So now, moving on, the recent national research has increasingly highlighted the connection between food insecurity and broader social determinants of health, including chronic disease, mental health, educational performance, and healthcare utilization. So this is the one that we have not really touched with a lot of reports regarding food pantries. So again, let me just read this to you. Uh, re- Recent national research has increasingly highlighted the connection between food insecurity and broader social determinants of health, including chronic disease, mental health, educational performance, and healthcare utilization. So if you want more information, you can go to USDA food security reports, or one of the research from Feeding America. hunger research. So while these reports provide important insights into scope of hunger, many community leaders believe there is another story that remains largely untold. That story is the hidden impact of food access. When a child receives, so I'd like for you to, just really look at this, and, you may want to take some notes. When a child receives adequate nutrition and performs better in school, when a senior avoids a health crisis because healthy food is available, or when a family remains stable because food assistance frees resources for housing and utilities, those outcomes are rarely measured by traditional charitable food systems. And that's why for us, we have developed throughout the years, we have developed this Salt View software, which is solutions, accountability, leadership training software. And this software provide the output, but also the outcome. So let me continue on this. To address the challenge, which is again, we only see part of the story through the reports from, say, food pantries or other food banks or maybe other organizations. So to address this challenge, our organization developed SaltView, a next generation impact measurement platform designed to help organizations measure not only what they distribute, but also the social, economic, health, and community outcomes that follow. So again, for those of you who are just joining us, the topic for today is the biggest story about hunger may be the one we cannot see. And I pose a couple of questions already. What happens after the food is distributed? And now there's another question that I will share with you after this. So, on this report and also on this press release that I've written, I shared with them the charitable food sector has done an incredible job measuring activity. All right. But the future belongs to the organizations that can also measure transformation. Hunger is not simply a food issue, it affects education, health, workforce participation, emotional well being, and community stability. If we only measure outputs, we miss the larger story. When we begin measuring outcomes, we discover that the impact is far greater than we ever imagined. So again, we are very good in measuring the output, the number of pounds, number of people we serve, which is good. But now we need to really measure the outcomes, and through the outcomes we will discover and we may be able to answer the question, what happens after the food is distributed, right? Were those people, because they met us at the food pantry, had changed their perspective in life because they were given hope, encouraging words, and they were given positive feedback. They were given resources that they may not know available for them, or benefits that they may not know that is can be offered to them. So let me continue on this. This shift comes at a time when healthcare systems, foundations, government agencies, and community organizations are increasingly seeking evidence of long term impact rather than short term activity. Now, we can unpack this for a long time, but I'd like for you to do your own research as well, because again, I just want to paint a picture for you to share with you what's happening, I would say in my world, and that's not all of it, but in a short description, this is what I do day in and day out, is to train and to launch food pantries, to meet with people, to meet with volunteers, to meet with sponsors, to create systems and education, educational materials, referrals. All of those. That's what's evolving, and so I am in the front line as well. Uh, in a sense that I gather the data. Not I, but Faith, Hope, and Love, and then we train the people at the front line, which are the volunteers and the staff at food pantries. So again, this now advocates. Now let's go back to this sentence. Advocates believe that understanding the full impact of food access could help community make more informed investments, strengthen collaboration across sectors, and accelerate efforts to address the root causes of hunger. Now, granted that not everyone, can move on from being a recipient to being self-sustained. You have the elderly that, yes, they will need that help constantly to be sustainable, maybe handicapped physically or mentally, and some other people. But the majority, I can tell you this now, that the majority of the people who go to the food pantry are capable of changing the trajectory of their lives. Now, because of the plenty of food that we have, abundance of food that we have in this country, we multiply the number of food pantries. And we plant food pantries, we start food pantries, and we launch food pantries. But we want to make sure also that it's not just about food. You know, uh, Again, food pantries by definition is to distribute food to those in need. But for us, food pantry is a gateway to the community so that we can understand better what's happening in that town or in that community, and then understand also how we can help the individual who are, maybe some of them may be chronically needing help, but because they were not educated, they were not given opportunity or share information with them. So now we work with foundations. Faith, Hope, and Love has been a recipient of grants from private foundations and also from government foundation. We are working with CICF, Central Indiana Community Foundation. Thanks to them, we are able to reach out more senior citizen through their senior program. We work with companies for sponsorships like um, Penske, Central Supply Company, also Citizens Gas, and and not that we that's part of the building missional community. Not one organization can do it by itself. So we are working together to alleviate hunger beyond food. Then we work with healthcare, organizations such as Eskenazi. We're currently working with them right now, um, and we're trying to do this, the measurement of not just the output, but also the outcome. So now healthcare organizations are working with us as well. IU, Indiana University, have worked with us in the past through their diabetes impact project here in Indiana. And currently, we are working with Marion County Public Health Department. So again, you put together, you have the individual donors, you have the sponsorships from corporations, you have the private foundation, you have government. So everyone coming together. But as a service organization, educational education institution, which is Faith, Hope, and Love, we try to educate not just the people that we serve, but also the people that serve with us and people who will be serving in the future. Because our greatest asset in a food pantry is not food, and some of you may argue with that, but without people, there will be no servants at food pantries, and you will not be able to gather the food, even though you have food. I've seen food pantries that close that had a lot of food, but they close because of lack of people. And sometimes, or most of the time, lack of volunteers is basically lack of education, lack of training. They don't understand that, hey, we are actually part of changing the lives of people. It's more than just handing out food, which is just a part of it. The bigger part is that how can we come alongside with them? How can we relate with them so that we can uh, continue to work with them, connect them with other resources available, and then hopefully we walk with them through their transformation in life. And that's why with Faith, Hope, and Love, we do a lot of education. We have an academy, we have a university. So now, again, the conversation is beginning to move beyond a simple question of how much food was distributed. Now, the new question is what changed because of it? So I'd like for you to just like ruminate that in your mind. The first question I ask is what happens after the food is distributed and what changed because food was distributed, right? And so I'll go ahead and expand more on that. As communities across the nation search for sustainable solutions to hunger, that question may become one of the most important discussions shaping the future of charitable food access. So, that question, that's a big question. What changed because you have given food? Is it because a person, of course, the obvious question is that, yeah, I'm full now, or we provided food for 3 days for an individual and they changed for 4 days, right? But what happened after the bags of groceries, donated groceries, is empty, right? They may have to go back again. The you may have heard what it says in a charitable organization that you work yourself out of a job, meaning that that's the ultimate success, is that we diminish the number of food pantries rather than increase the number of food pantries. Now you may say, well, why do you still launch food pantries? Why do you still train people? That's because food pantry in our definition is not food distribution. It's actually we're creating a missional community, a community that provides for emergency assistance, but at the same time engage, involve, and encourage people to be part of the solution and not to be part of the problem. So let me share a little bit about that. That in the context of our organization, Faith, Hope, and Love, is again, from the premise of our greatest asset are the people. We need to inform, we need to educate, we need to train our staff, our volunteers, because they are in the front line. If a volunteer, and you probably have experienced this in the past, has been asked to come to a food pantry, give away food, yes, we feel good about giving food to other people. That's normal. But beyond that is that how can we go beyond just giving food? That yes, here is the food, here's a bag of grocery that we would like to share with you. But what are those other things that maybe we can direct you, assist you, refer you to other resources. It could be education, it could be maybe addiction counseling, it could be many things, because food insecurity is, for many instances, is just a symptom of many challenges in life. And so, yeah, so now you have like the social determinant, these determinants of health, right? For food. Uh, and there are many factors. It could be uh, economic, right? Social and things. So that's what we try to do. And this is, again, I'd like for you to, if you would follow my blog, with Merlin, that F, merlinfhl.wordpress.com, and I will post more information there. So again, the two questions I'd like to pose to you is that what happens after the food is distributed, and what changed because of it. Now, I'd like to give you a taste of um, the Salt View, and then we will make this public, this report. This report is a summary. It's the outcome and not the output, although it includes some output also. So we measure the number of people that we serve. That's uh, 7,548 unduplicated individuals. But because of the food that our network food pantries have given away, 13.8 million in avoided healthcare costs was saved. So now you may say, how that happened? And we will show you a little bit more about how that happened. The social ROI, or return on investment, for every dollar invested, $27 in health savings is incurred. $27 in saving health, so healthcare costs. So let me tell you about, we measure who is being served. We serve people from Marion County, Johnson and Hendricks County, Delaware County, and many other counties out there. The gender distribution, we serve 32% are women, are no no are men, and women are 68%. Racial and ethnic composition, this is based on 2025 for the entire year. 59.9% are African American, 23% are Caucasians, Hispanic and Latinos are 14%. Now, the age group, you might think, okay, so what about the ages? So these are the working group, which is ages 30 to 64, which comprise of 47% working age adults. 30 to 64 years old comprise of people who go to the food pantry, and they are at working age adults. So that's a lot. That's 47%. Older adults, and fixed incomes are 20%, 33% under 30, which has nutritional gaps that can affect learning and long-term, development. So let me share with you the clinical critical finding: the concentration of data poverty in traditional data. So this finding is that the food access, uh, food insecurity has something to do with, one way or another, or combination of this, is poverty, education, safety, and health. They are interconnected structural factors. So for economic pressure, food insecurity is linked to the gap between income and the cost of living. Educational gaps: vulnerable urban areas have lower high school completion rates. The vulnerable urban areas, um, and then health and access: limited access to medical services and chronic illnesses, especially among older adults, reduce preventive care. Food desert worsens nutritional condition. So now you may be wondering, what about the economic value? So that's the social value, right? And now the economic value, public health, because of the missional food pantries that we have trained, launched, and now they are, many of them are self-sustaining. It says that 13,843,000, $843,032 in avoided annual health care cost. And so that's, we computed that based on their savings, that because they were able to go to a food pantry, they received the food, uh, you know, altogether, they saved $1,834 in annual health care cost. So now you multiply that by 7,548 unduplicated individual throughout 2025. That accounts to 13,843 thousand and $32. Now, in education, you may think, okay, so what about the education? But if you're a teacher, you're a parent, you know that if your child lacks nutrition or food, food and nutrition, they may not have more of the cognitive um, mindset and stabilizing their brains, right? So we computed that based on Georgetown.edu reports on college, right? Payoff. So the individuals who lose, concentration or maybe understanding academically, we have figure out, again through the reports and also the help of other reports, that 260 to 400,000 in lost lifetime income per person who doesn't complete secondary education. Stabilizing households with children protects future earning potential. Now, we talk about public health, which has something to do with food insecurity, education, and now we talk about safety and justice. And then this is very important also, and you can look at this at www.in.gov/IDOC, safety and justice. It is estimated that 20 to 25,000 per year incarceration in Indiana. If just 1% of the population that we serve, which is 75 people, 1% of 7,548 enter the justice system, the cost would exceed 1.5 million to 1.875 million annually. That's because desperate people do desperate things. If you're a father and you're underemployed, no food in the refrigerator, and no source of income, baby's crying, what do you do? There's actually one story that I heard. There's a Meyer here in town that's starting giving away baby food, donating baby food to people because they have a lot of stealing that's happening in their store for baby food. So they start donating, and there were less crime and stealing. So there are many more that I would like to share with you, but this report is very important, and this tells the other part of the story, the cost of inaction. We need to have an integrated view of what's happening. So now we can conclude from the economic point of view, the cost of inaction is 13 million in public health. That's if we don't do these things, we don't measure the outcome. Labor productivity is 1.4 million. Justice system is 1.5 million. older adult care is 1.5 million, educational systems 1.2 million. So total estimated cost is 19.5 million annually. And this is what we would like to share to everyone, that this report is very important, the knowing the other part, the outcome, what happens next after the food is distributed to people. And SaltView makes this possible. It's understandable. We use technology, and we use also, our own human resources. We need to understand who is being served, identify the vulnerability patterns of the individuals, and measure real impact, the true reach of the intervention beyond traditional metrics, and evidence-based decision making, use of real data to allocate resources and design more effective intervention. So now, lastly, I'd like to share this with you: three levers of intervention from faith, hope, and love point of view. Is SALT view. We need to measure the output and outcome. Then the next one is to stabilize the community, the situation, through community programs, such as connecting them with different programs. That's to stabilize the situation. And then the third one is pathway, which is the new software that we are developing to resolve vulnerability from the roots through individual empowerment. And we will talk more about pathway later on. So hopefully that gives you some perspective today. I hope I did not lose you with all those numbers, but we will continue to share this information. And, for me, I have shared this many times with the people that I train, the churches. I myself personally have trained over 300 congregations, not just trained, but also mobilized them in the community. And this is what I found out, is that revelation is not for you to keep, but for you to share. The same thing as knowledge is not just for you to keep, but also for you to share. And this is what we're doing, is sharing the revelation, sharing the knowledge, sharing the research that we have found, because we would like to not just share it, but to educate you, the donors, the volunteers, the staff, about what we're doing in our ministry and in our offices, and how we do it, which is also important. So we work more on the why we do it, and then the how we do it, we also share it with you. So if you do have, thanks, Keisha, for your input. And for those of you who have any other comments, or any things that you would like to suggest, questions, we do have a couple more minutes here. You can put that on the chat. If you are on Facebook, you can just put that in the comments, and I can see that here. So again, before we move on, um, I'd like to encourage everyone that the it's not new. What we're doing is not new. This is based on what the Bible had told us many, from the beginning, that we deal not with just food, but we deal with people. And if we have any, uh, you know, things that we can do for the progress of this generation and and the next generation to come, let's do it together. Giving food is easy. If somebody give me food, I can give food to others. The hard part is that how can we walk alongside those people that we meet at food pantries, food line, or somewhere else, that because they met us, that hopefully it had touched them, it had given hope because we don't just give them physical things, but also we would like to help them to become more sustainable. So let me pray and we will end this session. God, we thank you for the revelation. We thank you for the technology. We thank you, Lord, for the things that you're doing in our lives. I pray that you will continue to pour out, open the floodgates of knowledge and wisdom and resources that we will be able to serve you and your people even better. Pray in Jesus' name. Amen. All right. God bless you all. And we will talk to you again next month. Keisha has something here. How can other community organizations converge to help bring deeper and wider impact? And that's coming together. Again, we're not the only organization doing this, but it's not a popular um, topic, and we would like to help whatever we can. So you can contact us via Facebook, or you can email me at merlin@fhointernational.org. We do have other divisions at Faith, Hope, and Love, the Academy, University. We're actually graduating pastors and leaders in Kenya next month, and we're going to start our academy this school year in August. We have United Food Missions that work with government agencies, healthcare organizations, and providing beyond food to people. And then we do have the Latino divisions, the Salt View, and also Beyond This Hunger. The This is a workshop that, again, as I mentioned earlier, people in this country are hungrier more mentally, emotionally, and spiritually than physically. All right, God bless you, and I'll see you again next month.